Hi guys, welcome back to Scrub and Spoon, and this is Nurse Funke here. I hope you're having a good day. Guys, please don't forget to subscribe, like, share and comment. That is the best support you can give to us here. Thank you guys so much. And today we'll be talking about heart failure questions and answer, okay? And this is good for the RN, the RPN students. So please watch till the end and don't forget to like, okay guys? Let's go. So the first question says, a client with heart failure is prescribed lisinopril. Which of the following findings require immediate notification of the healthcare provider? A, potassium level of 5.1. B, dry, non-productive cough. C, blood pressure of 100/70. And D, swelling of the tongue and lips. You can pause this to choose your answer. And guys, the correct answer is D, swelling of the tongue and lips, and this is a sign of angioedema. Now look at the medication they are taking. They are taking lisinopril. This is HESI inhibitors, right guys? So, and this is it's almost like an allergic reaction to the medication. And what this can do, angioedema, and that's when there's swelling of the tongue and the lips, and this can cause restriction of airway if care is not taken. And that is why, remember your prioritization, your ABC, airway, you don't want to play with it, okay? Okay, airway, breathing and circulation. So the first option says potassium level of 5.1. This is slightly high, very slightly, because the normal range is 3.5 to 5, and this is just 5.1, so there is no need for like immediate intervention. And dry, non-productive cough, this is usually common side effect of taking HESI inhibitors, right? Blood pressure of 100/70. This is still okay, right? If the blood pressure is less than 100, and that's when you don't give the medication HESI inhibitors. Okay guys, I hope that helped. The next question says, which medication should the nurse question in a client with heart failure who is also taking digoxin and has a potassium level of 2.8? A, furosemide. B, spironolactone. C, losartan. And D, amlodipine. Guys, what's your answer? And guys, the correct answer is A, furosemide. We all know that furosemide is loop diuretics, and what do? They help you to excrete fluids out of the body. You're losing potassium when you take this diuretics. But guys, look, the potassium level of this patient is already 2.8. So if you should give more furosemide, you're going to reduce the potassium, and that will cause cardiac arrhythmias, right guys? And you don't want that to happen. So, and that's why furosemide is the right answer. B, spironolactone, is a potassium sparing, which is good, yes, and can help this patient because their potassium is low. Losartan, this is ARBs, and amlodipine also, this is calcium channel blocker. They really do not have direct impact on the potassium. Okay guys, which of the following best explains the purpose of spironolactone in heart failure management? We just said something about that, right? A, increase urine output by blocking sodium. B, decrease preload and afterload. And C, blocks aldosterone to retain potassium. And D, provides improves myocardial contraction. And what's the answer? And guys, the answer is C, blocks aldosterone to retain potassium. And that's what, like I mentioned to you, spironolactone is the potassium sparing, and this is the mechanism of action of spironolactone. Okay guys, so let's go over the wrong choices. Option A says increase urine output by blocking sodium. This is more applicable to loop diuretics, right? Like the furosemide we were talking about. And so it's not the right choice. And B, decrease preload and afterload. This is more applicable to ACE and ARBs, right? They help you to lower the blood pressure. And D, improves myocardial contractility. This is a function of digoxin, okay guys? So that makes C the right answer. A nurse is teaching a patient newly prescribed digoxin. Which statement indicates a need for further teaching, guys? Further teaching. A, I will check my pulse. And guys, how do we treat further teaching? You want to treat each question like true or false. So A, I will check my pulse before taking this medication. B, I will eat food high in potassium. C, I will report nausea or vision change. D, if I miss a dose, I can take 2 next time. Guys, what is your answer? So guys, the right answer is D. Now, when they say which of these require further teaching, means which of these statements is wrong. That if your patient mentioned this, you have to re-educate them that is not the right thing to do. So they said, if I miss a dose, I can take 2 next time. Guys, never ever ever, when they miss a dose, you don't tell them to take next time they remember, right? Especially for digoxin that can lower the heart rate. Okay guys, so this is a complete wrong statement. Okay, never double up on digoxin. Okay, I will check my pulse before taking this medication. Absolutely right. If your pulse is less than 60, you have to hold that medication. Okay, I will eat food high in potassium. That is good. Okay, and I will report nausea or I will report nausea or vision changes. This is classic sign of digoxin toxicity, so you should report this. Okay, and what could cause digoxin toxicity is hypokalemia, low potassium. So that's why you have to monitor your potassium serum while your patient is on this medication. Which medication combination poses the highest risk for hyperkalemia in a heart failure client? A, digoxin plus furosemide. B, lisinopril plus spironolactone. C, carvedilol plus furosemide. And D, amlodipine and hydrochlorothiazide. Right? Guys, what's your response? And the correct answer is B, guys. Now, look at the questions. Highest risk for hyperkalemia. If you combine lisinopril, which has potential for increasing your potassium level, which can elevate the potassium level because it blocks the RAS system, right? And potassium is not being excreted out of the body. If you combine lisinopril that can elevate potassium level with spironolactone, which is a potassium sparing diuretics, that's gonna spike your patient potassium level, right? And that's why that's the answer. Digoxin and furosemide actually lowers potassium, excretes potassium out of the body, and can cause hypokalemia. Carvedilol and furosemide are not risky for potassium, okay, increase, right? And D, amlodipine and hydrochlorothiazide. Remember, that's also a loop diuretics that reduces potassium out of the body, so that can actually lower the potassium. Okay, guys. Which instruction should be given to a client taking Furosemide for heart failure? A, take your medication with high fat meals. B, skip your evening dose if you feel well. C, you may experience headache with this medication. And D, stop taking this drug if you feel dizzy. And the right answer is C, you may experience headaches with this medication. This is one of the common side effects of Vasodilator like Furosemide. So let's go through the wrong choices. Take your medication with high fat meals. That is not needed. Okay, guys. Skip your evening dose if you feel well. Guys, we never give this kind of education. Do not tell your patient to skip any medications. They must complete the full course of their prescription, right? Any medication they have to complete it. Do not tell them to stop abruptly, or if they feel well, to stop taking it. That is the wrong teaching, so don't give that kind of teaching. Stop taking the drug if you feel dizzy. You have to call your healthcare provider. You just don't stop abruptly, right? Because that can even have stronger negative effect. Okay, guys. So don't stop abruptly. Do not stop taking it because you feel well. These are wrong teachings, guys. Okay. A nurse is reviewing the medication list of a client with heart failure. Which medication on the list should be questioned? A, naproxen. B, furosemide. C, lisinopril. And D, metoprolol. Guys, I think the answer is just right there. This should not take you a blink of an eye to know what the answer is, because all the options listed here from B to D are all heart failure medications except naproxen, which is NSAIDs, right? Naproxen can cause sodium and water retention, and it can worsen the heart failure, so you do not want to give your patient, guys. Okay, which instruction is most important for a nurse to give a patient starting furosemide for heart failure? Take this medication at bedtime. Limit your fluid intake to 500 ml daily. Weigh yourself daily at the same time. And D, expect your urine to turn orange, guys. And the right answer is C, weigh yourself daily at the same time, because checking your weight daily is the most accurate way to know your fluid status, guys. So it's the right option here. Let's go through the wrong one, especially for furosemide that helps you to excrete a lot of fluids out of your body. So you really want to weigh yourself every day to know that, okay, the furosemide is giving you the therapeutic effect, right, as expected. A, take this medication at bedtime. Guys, you don't want to tell your patient to take this medication at bedtime. They have to take it because that can cause nocturia, like that is, they'll be going to pee in the night, and guess what that can cause? It can cause them to fall because they keep taking trips to the bathroom, and they can fall if care is not taken, right? Especially for the older adults. That's what I mean, the seniors. Limit your fluid intake to 500 ml daily. Guys, you don't want to tell them to do this because they are already losing fluids, and when you tell them to reduce the amount of fluids they are taking, that can cause dehydration for them. It can lead to hypertension. So do not tell them to reduce, because they are already taking loop diuretic that is excreting fluids out of their body, right? So if they are short on fluid in the body, it can cause electrolyte imbalance and dehydration. So you don't want to tell them to do that. Expect your urine to turn orange, guys. That is not part of furosemide function. This can be seen with medication like phenazopyridine, right? And this medication is used to treat signs and symptoms of UTI, and that's when you can see your urine turn orange or yellowish. Not for furosemide, guys. Nurse is teaching a patient with heart failure about lifestyle modification. Which statement indicates a need for further teaching? Remember, guys, further teaching. This means false statements. False statements. I will weigh myself every morning. I will call my provider if I gain more than 2 pounds in a day. I will use salt substitute instead of table salt. I will try to walk most days of the week. And guys, of this statement, the one that requires further teaching is C. I will use salt substitute instead of table salt. Guys, patients with heart failure, most of them, most likely they're already taking ACE inhibitors medication like lisinopril, right? And remember, when you are taking this kind of medication, you are not excreting potassium out of the body. So if you should now take salt substitute, most of the salt substitute contain potassium. So it's like you are doubling the dose, because you're already taking ACE inhibitor that can likely increase your potassium level, and you now taking salt substitute, and that also contain potassium. That can that can cause hyperkalemia, spike it up, okay? And that's why you want to educate them not to take any salt substitute, okay? The one that says I will weigh myself every morning, like I told you guys, weight check is the best way to check your fluid status. It's the most accurate way to check your fluid status, which is good. I will call my provider if I gain more than 2 pounds in a day. If you're taking furosemide and you're still gaining 2 pounds a day, that means something is going on. You're not excreting fluids out of the body. You're gaining instead of losing fluids, right? So you definitely want to call your healthcare provider. I will try to walk most days of the week. Walking is good. It's best exercise. It's helped increase the heart function. It's really good. So which finding in a client taking spironolactone should be reported immediately? Potassium level of 5.8, report of breast tenderness, sodium level of 136, mild dizziness after standing. Okay, guys, the right answer here is potassium level of 5.8. You want to know why? Spironolactone is a potassium sparing diuretics. So if your patient is already taking this, and look at their potassium, normal potassium is 3.5 to 5. This is high, 5.8. So you want to report this immediately, because anytime potassium is high or low, remember, cardiac, it can cause cardiac arrhythmia, cardiac dysrhythmia. So you want to put your patient on thorough heart monitoring, cardiac monitoring, okay, guys? And that's why this is the option that require immediate report, okay? Immediate report. Let's talk about report of breast tenderness. This is a non-side effect, and it's called gynecomastia, right? So that is not like life-threatening compared to potassium, because once your potassium, like I said, once the potassium is high or low, you want to monitor the cardiac, the heart, okay? And sodium level of 136 is within the range. Sodium is 135 to 145. That is actually okay. And mild dizziness after standing. They are not critical findings compared to the potassium being elevated, guys, okay? And guys, let's take the last question for this section. The nurse is preparing to administer metoprolol to a client with heart failure. Which assessment is most important before administration, guys? A, blood glucose. B, respiratory rate. C, heart rate. And D, temperature. And guys, the right answer is heart rate. Like I said, I mentioned earlier that you want to check, metoprolol. This is beta blocker. Remember, double L's, they lower the heart rate and the blood pressure. You want to check your patient's apical heart rate for at least 1 full minute before giving this medication. And I said, if it's lower than 60, you hold that medication, you do not give, okay? So that's why that's the right answer, because it can cause bradycardia, okay, guys? Let's talk about blood glucose. Beta blockers actually don't mask blood glucose level. It is relevant, but it's not the top priority, right? Respiratory rates, it is useful in asthma patients, but still secondary, right, compared to what you have to check before administering metoprolol. And temperature, that's not directly relevant to metoprolol. All right, guys, if you have enjoyed this section, please, guys, do not forget to like, share, subscribe, and follow me on all platforms. Scrub and Spoon on TikTok, on Instagram, and here on YouTube. Guys, until next time, take care.